All right, so today's episode is how Mac and I get into the topic. Is TMD a curable situation? The honest truth. We're going to really get into it. What causes TMD, and can you get the help you need? All right, I got a topic for us today, Mac, and that is.
Give it to me.
All
Give
right,
it
you
to me.
ready? Good thing you're seated.
Yes.
Can TMJ issues be cured? The honest answer, because we're going to
Okay.
open it up.
Here's going to be an honest answer. Dentists go through dental school and they get their brains fried because they make everything way too difficult. And you have to have this study, you have to have that study. So let me pick out one word that you said, and that's cured. Dentists can spend a lifetime talking about what does cured mean. In reality, for these people who listen to us, the people who have pain, I'm going to say that cured to them means I'm not in pain.
I like that.
Would you agree?
I think that is very honest and real.
I don't want to be in pain. As a child, I can't see the blackboard, and I needed to see the blackboard in order to be able to do my work. So my eyes are not working correctly, so I got to go get glasses so they are working correctly. And my eyes are different than everybody else's eyes. So people in pain have a true TMJ patient. Now, you can have migraines, you can have trigeminal neuralgia, you can have a lot of different things. But if we're talking about true TMD pain, it is going to be a mechanical issue where the teeth do not come together correctly. Your eyes don't work. It is a mechanical issue because the lens are not working correctly. It's not rocket science. So with a person who has a mechanical problem with the teeth, we can do an overlay, a plastic overlay on the teeth that mimics a perfect bite. I can put on my glasses and mimic perfect vision. So if I wear glasses, have I cured my eyes? Have I cured the mechanical problem of my eyes? No. But I've compensated by using modern technology that allows my child or me to see the blackboard or me to look out in this beautiful weather I'm looking at and watch the pelicans and the seagulls because I can see. So if my teeth are not hitting together mechanically and my brain decides it doesn't like that, it's going to create pain. So if I can go to an excellent dentist like Dr. Pamela Marzban in Burke, Virginia.
She is pretty fabulous.
She is fabulous. And she's smart because she knows what I know. And so therefore she's very smart.
He just complimented himself.
And you picked up on it.
Of course.
Okay.
Know you.
So yes. So let's talk about the word cured. Can you cure it? Well, if you take the mouthpiece out, patients can be a lot better, but they also can revert back to pain.
Right.
If I take my glasses off, I can't see. So that's just an analogy, but it is a simple explanation is that do you want to be cured or do you want to be pain-free?
So well said. I mean, our listeners, our viewers, if you haven't got the book, the trigemina, where is it? Here we go. The TMJ trifecta for you viewers, solving your pain puzzle. Mac, he breaks things down so simply and it can help you identify if you're suffering from a true TMJ issue. TMD is the right way to say it, really, is temporomandibular dysfunction. And if so, how you can identify what went wrong and who to look for, questions to ask. So it's such a simple book, and Mac just breaks things down so amazingly easily, just like that.
Well, but the thing is, to the people who have TMD pain, your pain is real. It's not in your head. The sad thing is there's no maybe 1.001 MDs understand it, neurologists understand it. There's probably only a 5% of the dentists that understand it like Pam and I do. So it's a real problem.
It is.
It is a real problem. And we understand and we're sympathetic to the fact that you can't find somebody to help you. And we're sympathetic to the fact that when you do, it costs money. And there's reasons it costs money. It's not because we're trying to rip you off. So, but let's get back to what cured means. And to me, I'll try to make it just as very simple as I can, you know?
You know, let's circle back to something else you said as a part of that. You know, there are ways for us to treat or quote cure TMJ patients, which is getting them out of pain and getting their quality of life back, getting them to function. And then there's also ways to help manage the symptoms because, like you said, true TMJ treatment is expensive and it's lengthy. Very true. It takes a minute. It takes a while, guys. It's a lot of equipment and training and a lot of time we have to invest in you to make sure we can help you and treat it correctly. But going back to, there's other things you can do if you're just managing how you feel. You know, we talked in one of our previous podcasts, very simple, like do it at home. You know, keep your lips together, tongue on the palate, teeth apart, chill out. That's simple enough and it can be super helpful. But there's other things that you can be doing. You can take certain medications because, like Max said a minute ago, most medical doctors and dental doctors are not trained on this stuff. This is something we became passionate about earlier in our career and learned a lot about. So when you go to those doctors and maybe you don't find us, they can prescribe you medications that will help calm down your nerve receptors, like your pain receptors to the brain, so you're not congested with so much pain feedback and suffering. And that way you can find a way to find trained dentists like us that can help you um, correct the problem, like restore your physiology, that balance. People of times have used Botox that can be helpful and it can actually be hurtful. Again, you have to vet the right people that are doing these injections because injectors, they come in all shapes and sizes nowadays, guys, and you better know who's injecting what into your face. But again, if they're doing it right, they're essentially paralyzing the muscle so you can't grind or clench, and the muscle spasm activity calms down. So less pain that you're suffering from. Neurologists, they will, like I said, give you medications that work on the brain level, meaning that they're going to numb the way you're processing what's actually happening. But none of these are actually correcting the structural issues at hand, which Mac talks about in his the TMJ trifecta book. You know, the bite is off, meaning posterior interferences are there. Having a torqued mandible, that lower jaw is off balance, is not sitting in a balanced physiologic position, is off kilter, if you will. And then, of course, mid-face deficiencies we talked about so much, retrognathic or underdeveloped faces that sets everything back to compress the joint and just aggravate those muscles. So, it depends on you, listener and viewers. Like, what are you wanting right now? Because we can all want the best, but sometimes the realistic stuff in life, whether it's money, time, whatever, it doesn't let you do it. And there's other ways to manage it.
Yeah, but the thing is all the Botox and all the medication just masks the problem. And the problem is a mechanical issue
Correct.
that only a very educated dentist knows how to treat. So it is a real problem. And the only answer is education.
Yeah.
Patients be educated by they go to the dentist and the dentist says, oh, you need a night guard. And they squirt material in between your teeth, have you bite down and send it off to the lab. That's not it.
No.
That's not the answer.
That's not
So
it. It
the
might once
answer,
in a blue moon work because a blind squirrel gets the nut sometime.
that's
No
right.
disrespect to my colleagues. Once in a while, it helps. A night guard's
Yeah.
purpose is to keep you from grinding your teeth. It's not for TMJ issues at all. It's not about dysfunction. And sometimes most people who are grinding their teeth also have sleep issues like apnea or upper airway resistance syndrome. So sticking a big piece of plastic in the mouth makes it even harder for them to breathe at night. further exacerbating their sleep issues. So I'm not an advocate for night guards at all. I know they're so common. I used to do them. That's all we're trained on in dental school, guys. It's not like dentists are up to no good. That's just all we're trained on. But if anything, if you have a night guard, I would ask your dentist to switch you to a clear retainer, which is an Essex, Essix retainer. Looks like Invisalign. That will get you off of your teeth and will not occlude or, make your oral airway smaller if you're struggling with airway when you sleep.
So our topic is, can TMJ be cured? And what is your answer to that? I gave you mine.
Yes, under your definition. Yes. So we restore physiologic balance. We just get balance and everything starts to calm down. It's that simple with a lot of training, but it's our job to make it look that simple when you come into my office and my team and I take care of you.
Good. Thank you.
That's it for today. Till next time, friend.